Hi, my name is Emma Pfeffer, and this is my video assignment for Foundations of Nursing for Aspen University. So I chose scenario number 1 for this assignment, and the scenario reads as Mr. O is 63 years old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to AMU with syncope. This is not his first time being admitted to the hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. He feels like he is pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to AMU at 1600 or 4 p.m. His nurse is Jenny, an RN. Jenny RN assessed him and found his blood pressure as 138/84, a pulse of 76 and regular, and his respiratory rate of 16. He is afebrile at 98.6. Mr. O's labs are normal, but his IV infiltrated during transport. Jenny RN started a new IV and put a warm compress on the old site. Jenny RN reported off to Ben RN at 1900 or 7 p.m. At 21:30 or 9:30 p.m., the PCA phoned Ben RN and told him that he had just helped Mr. O off of the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Ben RN went in to assess Mr. O. His vital signs were a blood pressure of 94/66, pulse of 114, and a respiratory rate of 24. His pulse ox was at 97%. He was pale and his skin was clammy. Ben RN asked him how he was feeling. Mr. O said he didn't just feel well and could not get comfortable. He asked if he could have something for his belly. It is really hurting. Ben RN assessed his abdomen and found that it was distended, and Mr. O had diffuse abdominal pain. He rated his pain as 6 on a scale of 1 to 10. So the pertinent data and findings that I found from this case study, first is that he does have a previous history of congestive heart failure and acute myocardial infarction. He does only take NSAIDs at home for chronic back pain, but based on his diagnosis, he might possibly have prescribed more, but he just might not be taking them, so maybe he should be on more medications. His vitals at admission were stable, but approximately 5.5 hours after admission, his health has declined, and he's now had a large black tarry stool and is complaining of not feeling well with belly pain. His vitals are not stable since admission with low blood pressure and a high pulse and respiratory rate. And again, his blood pressure at assessment at 21:30, his blood pressure was 94/66, pulse 114, and respiratory rate 24. His abdomen is distended upon assessment, and his pain is at a 6 out of 10. And so now we're going to go on to the simulation. For the simulation, I am Ben, the RN, and then my husband and mom are helping me out with this. Okay, so for my simulation, I have my mom, Sarah, who's going to be our doctor, and my husband, John, who's going to be our patient, Mr. O. So then you can move up. Okay. Knock, knock. Hi, Mr. O. I'm Emma, your nurse. My care assistant told me that you're not feeling well. Can you tell me what's going on?
Hello, Emma. He was helping me use the restroom, and I'm just not feeling well. My belly really hurts, and I just can't get comfortable.
Okay, what would you rate your belly pain at right now? 0 is no pain, and 10 is the worst pain that you've ever felt before.
It's a 6. It really hurts.
Okay, can I take a look at your belly?
Yeah. Sure, but be careful. It kind of hurts.
Okay, let's see here. Yeah, Mr. O, your belly seems a little swollen from earlier today. Let me call your doctor, Dr. Sarah, to see what she thinks. I'll come check on you after I give her a call.
Okay, thank you.
Okay, buzz, buzz. Ring, ring.
Hello, this is Dr. Sarah.
Hi, Dr. Sarah. My name's Emma. I'm an RN calling in regards to Mr. O in AMU room 5. Mr. O just had a large black tarry stool about 10 minutes ago and complains of not feeling well and is having abdominal pain. He's a 63-year-old male who is admitted to us today for syncope from the ER. He has a history of congestive heart failure and acute myocardial infarction. He has a new IV as the previous one became infiltrated during transport. No pertinent lab findings, but his last vitals were about 5 minutes ago. Blood pressure of 94/66, pulse of 114, and a respiratory rate of 24. His oxygen was at 97%. Pale and clammy skin were noted, and the patient states a pain level of 6 out of 10, and abdomen is distended upon assessment. Based on his pain level and a distended abdomen with black and tarry stool, my assessment is that there is a bleed or abnormality within his gastrointestinal tract. If you'd be able to, I would like you to please come assess this patient to determine if a colonoscopy or other procedure should be performed to determine further testing or treatment. Would you be able to do that?
Okay, I will come down there right away and take a look at him.
Okay, I'll see you in a minute. Okay, so we're covered. Okay. Knock, knock. Hi, Mr. O. This is Dr. Sarah, and she's going to take a look at your belly, okay?
Okay. Thank you.
So now that we've done the simulation with my wonderful participants, I'm just going to debrief on how that went. So, number one, what were your thoughts on the clinical scenario? I think it was a good scenario. Reading through the different case files, I thought that this one, based on the assessment findings that were given in the scenario, that this one was a decently relatively easy one to complete. Some of the other ones I wasn't as comfortable with, but just based on what was given, I thought it went well. Honestly, I thought my mom and husband were going to mess around more than they did, and I'm very grateful that they didn't. So it was nice to be able to go over that. It also is different since we're doing online versus in person. If we were in person, I would presume that we would get paired up with another person and work through scenarios or just submit our SBAR documentation. Number two, what do you think could have been added to the SBAR? I think if I was given more lab info, or when we're in the hospital, we'll have recent labs, so it would be nice to include labs, like especially for this case, if he has a history of congestive heart failure and myocardial infarction, some cardiac tests, lab tests should be run, get the results of those to see what's going on. Just like a basic metabolic panel, a complete blood count, just to determine kind of what's going on in the body, if there's an elevation in white blood cells, what his hemoglobin's at, just kind of see where he's sitting at, so that way we know for sure maybe what the cause could be. Number three, what do you think we did not need in the SBAR? One thing that I have done through personal experience as an LPN, to me, I've always kind of tripped up on the recommendation portion of SBAR, because the doctors or physicians are ultimately the ones who make the care plan and who sign off on orders and procedures and tests. So it's important to make recommendations like, hey, I think you need to come see this one right away, or, you know, they starting to stabilize a little bit more. It's a little hard, but I guess another thing, going back to what could have been added, was maybe relaying a little bit more urgency about the situation. In real life, it's definitely more urgent, but since we had a script to go off, it was more of a, oh, hey, this is what's going to happen next. It's not so black and white in real practice. It's more of a gray area. You need to do what needs to be done at that point. So if number four, if we did this conversation again, what should we do differently? I think I kind of touched on that. Maybe I'd have my patient laying down next time, just to kind of portray a little bit more of a hospital setting versus sitting in my desk chair, but that's what I had for resources. Maybe I could have had someone hold the camera instead of doing it on my laptop. That way we could zoom to one side for the patient area and then back to the other side for like the nurse's station and like me calling the doctor and us discussing. I guess I could have also used a real cell phone instead of just my hand, but that's, again, what was easy. Number 4, do you think the significance of the situation was clearly presented to the physician? Since, again, it was a script and just a simulation, I don't think I related as well as I could have. I think to do it again, I would, be like, hey, they're really declining. About 5 hours ago, his blood pressure was 138/84, which is a little elevated, but it's not within a hypertensive state. But now his blood pressure is at 94/66. So to have a 40-point drop in the systolic and then a 15-point drop in diastolic, that's a relative amount of drop in a blood pressure to be concerned. And then since his pulse and respiratory rate were high compared to normal, something's going on and it needs to be assessed more than it probably was. But again, that comes with practice. But again, with just having a written script, it was more of a, okay, read the next line, go on that. So I think I'd work on that more for especially our next class which is health assessment. Thank you for listening, and that's all that I have for you. Thanks!